You may have heard of diaphragmatic breathing and how beneficial it is, especially after giving birth. However, so many people do this type of breathing incorrectly, and today I'm going to show you how to perform it correctly. Hi, my name is Dr. Jessica Babich, and I'm a doctor of physical therapy with specialty training in pelvic health. If you find this channel helpful, I encourage you to like and subscribe below. Often, when people think of diaphragmatic breathing, they often think of that belly breathing where they're forcing air out through their tummies. Immediately after giving birth, this is not appropriate as your abdominal wall is already lax and weak. If you're forcing air out through the front, you're actually more at risk for a diastasis recti, which is that splitting of the abdominal muscles, an umbilical hernia, or prolapse. So we really don't want to only be breathing through our bellies. Diaphragmatic breathing is actually more of a 360 breath. And before we go over how to perform that breath correctly, I want to talk about the relationship between the diaphragm and the pelvic floor and how they work together to create core stability and regulate pressure within your trunk. Sit in the bicycle seat area of our pelvis. Now, as we inhale, we get a lengthening and descent of the diaphragm and pelvic floor towards our feet, and on the exhale, they recoil back to center, and that's what helps to create core stability, regulate pressure, and actually helps us to perform an efficient 360 breath. Now that we understand the relationship between the diaphragm and the pelvic floor, let's go over how to perform a diaphragmatic breath correctly, and I'm going to have you go ahead and join me with this. So let's find a comfortable position sitting, and let's try to get into a position where our rib cage can be stacked over our pelvis. This stacked position is important to be able to perform a 360 breath, because as we discussed earlier, the diaphragm and pelvic floor work together. So when our rib cage can be stacked directly over our pelvic floor, we have a marrying and a great communication of these muscles. So what I'm going to have you do next is place your hands around your rib cage, and let's just get what your natural breath is doing. So let's take a deep breath in and exhale. What did you notice happening under your hands? Did you notice that you were breathing more forward or more into your chest? If so, that's okay. What you should feel, however, is that you should feel as you inhale, you should feel a slight expansion into your fingers into the front, a slight expansion sideways, a slight expansion back, and expansion into your pelvic floor. Nothing should be forced. Often it can be helpful to think of a balloon. So think of a balloon that sits right underneath your rib cage. So as you inhale into that balloon, you get a 360 blowing up of the balloon. It expands in the front, out the sides, into the back, and down. And on the exhale, it recoils. So I often think of a balloon, or I just think of the mechanics of the diaphragm and the pelvic floor to help me achieve this breath. It's also helpful to use your hands. I like using my hands as a tactile feedback around my rib cage, but if you feel that you're not feeling as much sideways expansion or backwards expansion or into your pelvic floor, you can bias your hands into those places and try to connect your breath to your hands. So let's go ahead and try this again. Place your hands where you felt you weren't feeling breath, and let's take a deep breath in. And as you inhale, think of that balloon expanding in a 360 manner. And as you exhale, the balloon recoils back. If you still don't feel it, that's okay. It can take some time to rebuild that brain-body connection. However, the more you practice, the more automatic this will become. There are so many benefits to diaphragmatic breathing. Besides regulating pressure in your trunk, which helps aid in digestion and bowel and bladder movements, it also contributes to core stability. And immediately after giving birth, we don't have an automatic core strategy anymore. So practicing 360 breathing in diaphragmatic breathing is safe to perform immediately post-birth, and it also